Trying to figure out ADHD treatment can feel, well, like you've been given a map without a legend. There's just so much information, so many different options out there. But what if you had a clear guide? In this explainer, we're going to give you that map. We're breaking down exactly what high-quality modern ADHD care really looks like. And if you're feeling overwhelmed by it all, hey, that's totally understandable. The good news is there is a clear, proven path forward. Think of this as your personal guide to not just managing symptoms, but really starting to thrive. It's all about getting you the clarity you need to take that next step with confidence. Okay, so let's dive right in. We've laid out our journey into 5 key parts. First, we'll define what quality care even means. Then we'll talk about how to choose the right professional, understand the actual treatment process, get you started with a super practical checklist, and finally, take a look at the long-term journey. So, first things first, what are we even aiming for? To get the best results, you've got to know what a modern, really comprehensive approach to ADHD treatment actually involves. This is all about setting a high standard for your own health. Okay, this term right here, multimodal approach, is super important. This is the gold standard, and for a really good reason. It means top-tier care isn't just one thing. It's a whole strategy working together. For example, medication might help with focus, while therapy gives you the tools to manage your time and build better habits. It's about treating the whole person, not just a single symptom. And before any of that treatment begins, a proper diagnosis is absolutely critical. And I don't mean a quick chat. A quality assessment is a deep dive into your history to make sure that what looks like ADHD isn't actually being caused by something else entirely, like sleep apnea or even certain nutritional issues. This is exactly why a quick online quiz just doesn't cut it. A thorough diagnosis is what protects you and makes sure you get the right treatment for the right thing. All right, so that leads us to one of the most important decisions you're going to make: choosing your clinical guide. And you should really think of your healthcare provider as more than just a doctor. They're your expert partner who's going to navigate this journey with you. So the big choice here often comes down to a specialist versus a generalist. And honestly, the difference is crucial. I mean, you wouldn't go to your family doctor for a really complex heart issue, right? The same idea applies here. A board-certified specialist in this field brings a level of focused expertise that can make a huge difference in your results. And this table just lays it all out, clear as day. Take a look at the initial assessment time. A high-quality approach dedicates 60 to 90 minutes. The bare minimum? Sometimes just 15 to 20. And notice the provider type, a specialist versus a general practitioner, and the fact that therapy is built in, not just medication. This really shows the night and day difference in the level of care. Okay, now let's get into the nitty-gritty of the process. How is ADHD actually diagnosed by a professional? And once it is, what are your options for treatment? This is where the real plan starts to come together. Like we said, the process is rigorous for a reason. So many other conditions can have symptoms that overlap with ADHD. A skilled clinician uses specific interviews and rating scales to carefully tell the difference between, say, the distractibility you see in ADHD and the kind of looping, anxious thoughts that come with an anxiety disorder. It's a subtle but incredibly important distinction. So once you have that diagnosis, the treatment is definitely not one size fits all. Medication is often a key tool, for sure, but it's so much more powerful when it's supported by things like psychotherapy for building new systems or executive function coaching for day-to-day skills. This is where that whole multimodal approach we talked about really comes to life, creating a support system that's tailored just for you. This brings up a really practical question, especially for busy professionals today. Does all this have to happen in a doctor's office? Can you actually get effective treatment through telehealth? And the answer is a clear and simple yes. Virtual care is a standard, effective, and totally normal part of modern healthcare. As long as that initial clinical relationship is properly set up based on your state's laws, things like remote prescriptions and ongoing therapy are absolutely possible. It makes getting consistent care so much more accessible. All right, you get the concepts. Now let's make this super practical. This section is your actionable checklist. These are the concrete steps you can take to get your journey started with total confidence. So here are 6 key things to ask about. First, verify the provider's state license. Easy. Number 2, ask for your formal diagnostic paperwork with the official DSM-5 coding. Now, that code is basically the universal language doctors use, and you might need it for insurance work accommodations. Also, make sure you understand their prescription policies, check if they coordinate care with your other doctors, establish a baseline for your symptoms so you can track progress, and finally, see what other services they offer. Okay, final part. Let's talk about the long game.
Because managing ADHD isn't a one-time fix, right? It's an ongoing process that evolves as you do, and that's what ensures lasting success.
This is all about what we call clinical vigilance. It just means having regular check-ins and monitoring your health. Things like tracking your heart rate and blood pressure if you're on certain medications. This isn't just a good idea. For some medicines, it's actually a legal requirement to make sure your treatment stays both safe and effective over the long haul. I absolutely love this analogy from our source material. Think about it. You wouldn't just guess with the chemicals for a swimming pool, right? Well, managing the complex biochemistry of ADHD medication needs that same kind of precise expert adjustment. It just perfectly captures why having a professional manage this is so important. And in the end, all of these steps, all these standards and strategies, they all lead back to this one powerful goal. The whole point of getting high-quality care is to improve your ability to function, to focus, and to genuinely thrive, no matter how demanding your world gets. So, there you have it. You have the map to finding clarity and getting effective treatment. You know what to look for, you know what questions to ask, and you know what to expect on the road ahead. The only question left is, what's your first step?